We're going to demonstrate the skill of using a lighted stylet, which is a very handy tool for those difficult intubations. Now, of course, before you go and do the procedure, you've got to make sure you have all your equipment. So, of course, we want to make sure that we have our lighted stylet, and hopefully with that we checked our batteries in the morning at the start of our shift. We want to make sure we have our wand, which goes with the lighted stylet, and make sure that it has the rigid, hard stylet within. We want to make sure we have an appropriate size endotracheal tube for the patient. We want to make sure we have a syringe to fill the bulb. We want to make sure we have suction ready to go. We want to make sure we have oxygen running and a bag valve mask ready to go with filter in place. Now, of course, before doing any advanced airway procedure like intubation, we want to make sure that we have pre-oxygenated the patient well. And so we want to make sure that we do some good bag valve mask technique to pre-oxygenate the patient. Remembering that whenever we do an advanced airway procedure, we're really pausing for a while in ventilations. We're not able to ventilate the patient at all during the procedure, so we have to make sure that we've well oxygenated the patient prior to the procedure. So I do this for 30 to 60 seconds to make sure that he's well oxygenated, and then I could even have an assistant continue to ventilate him while I gather my equipment. Now, when getting the lighted stylet in place, it is like track lighting. You have to make sure that the contacts of the wand are going to ride along the contacts of the hand base part of the device. The other thing that's really important is, see the wire stylet? This has to be in this little notch here. I hope you can see that. If it's not in the notch securely, then the wand will, at the distal end, will bend side to side. It'll never stay midline and it'll never work for you. So this has to, a lot of times they're stored in the bags like this, but it really has to be securely in that little notch there. That's really important. Alright, then we take our endotracheal tube, feed it over the end of the wand, bring it into this slot here, and lock it in with the green tab. The next thing we have to do is also very important, and if you forget this step, it's not going to work for you. You have to line up the centimeters. So I don't know if you can see that, but I'm going to look at the centimeter markings and move my track until it lines up with the centimeter markings from the tube, the same as the wand. Okay, so I've got 23 on the wand and 23 on the tube lined up there. So I've made sure that this is locked in place, making sure this is out. So that's securely locked. Then I could test my bulb. You put on your bulb and you can see whether your battery's okay or dead. And in this case, the batteries are good. It's a nice bright glow. Now, the next step is where it says bend here. You got to do that right where it says bend here. Don't try and make it longer or shorter than it says. It has to be, just for the average adult, has to be right where it says bend here. Then you have to make sure you put a nice 90-degree bend. So it's not a hockey stick bend as you would for a normal intubation. It really is a 90-degree. Less than a 90-degree will give you a hard time to place it properly. Okay, so now let's say that my patient is well oxygenated. I remove my oral airway. Then I would get an assistant to dim the lights or shroud the patient so that I can properly see the glow. And what we're looking for is a strong red midline glow. So one of the important things also is to do a nice tongue jaw lift. If you don't get the tongue and the jaw out of the way, it also makes it difficult to do this procedure. So I've turned on my light and you can see a bit of diffuse glowing already. And what I'm doing, I'm just bringing it midline in the throat and I'm gently rocking back and forth like this. Now you see right there, I've rocked it backwards, not using excessive force because I'm going to lose the bend if I use excessive force. But I've just rocked it backwards and the tip has slipped up into the trachea, and that you can tell because we have a strong midline glow. Alright, next thing to do to advance it, we don't want to do any soft tissue damage, so I'm going to pull back on the wire stylet a few inches. Then I'm going to advance the whole thing a little bit. Then I'm going to take off the green clamp and advance the rest of the tube off of the stylet. And you can see the blinking light. That happens after about 30 seconds to remind you, hey, you've been in there too long, maybe it's time to get out and ventilate. In this case, I'm taking a long time because I'm narrating as I go. Now I'm going to put it at the appropriate depth, which is about 23 centimeters at the teeth. I'm going to put some air in this cuff. I put about 8 cc's and that was just plenty. Then I'm going to confirm placement. So I attach my BVM and I'm going to look for chest rise and fall, which I have. I'm going to auscultate over the epigastrum. There's no gurgling sounds there. And I listen over both lung fields, or all lung fields, make sure I have good bilateral air entry. And I do. And that's great. I could also place an end-tidal carbon dioxide detector between the bag valve mask and the filter to give me another, or a third way of ensuring that I do in fact have proper placement of the device. And that's it.